Your field pharmacy could be the difference between life and death when civilization collapses and hospitals become nothing more than monuments to a world that no longer exists. While others are hoarding canned beans and bottled water, the smart survivalist knows that medical supplies are the true currency of survival. A cut that gets infected, a fever that spirals out of control, or chronic pain that becomes unbearable. These aren't just inconveniences when there's no emergency room to run to. They're potential death sentences. And if you're watching this, you already understand that preparation isn't paranoia, it's intelligence. So before we dive deep into building a pharmacy that could save your life and the lives of those you love, hit that subscribe button right now. This isn't entertainment, this is education that could determine whether you survive or become another statistic when the world goes dark. Before going any further, it's crucial to make something clear. This content is strictly for informational and educational purposes. Before purchasing, storing, or considering the use of any medication or medical supply, always consult a licensed healthcare provider or physician. Never self-prescribe or use medicines discussed here without the explicit guidance of a medical professional who understands your health needs and legal regulations. Survival is about planning with knowledge, not risking harm through misuse or misunderstanding. Building a field pharmacy isn't about grabbing random medications from your bathroom cabinet and throwing them in a backpack. It requires strategic thinking, medical knowledge, and an understanding of what actually kills people when modern medicine disappears. The reality is brutal. In a long-term survival scenario, the leading causes of death aren't zombies or nuclear radiation. They're infections, dehydration, chronic disease complications, and untreated injuries. Your pharmacy needs to address these threats systematically, and it needs to do so with medications and supplies that remain effective, are properly stored, and can actually be used by someone without a medical degree. Let's start with the foundation: antibiotics. When the grid goes down and bacteria become your invisible enemy, antibiotics transform from convenient prescriptions into life-saving treasures. But here's what most survival guides won't tell you. Not all antibiotics are created equal, and stockpiling the wrong ones is worse than having none at all because it creates false confidence. You need broad-spectrum coverage that addresses the most common and dangerous bacterial infections. Amoxicillin is your first-line defense for respiratory infections, ear infections, and certain skin infections. Stock at least a month's supply in 500 milliliters capsules. But amoxicillin has a critical weakness. It's useless against resistant bacteria and certain severe infections. That's where ciprofloxacin enters your arsenal. This fluoroquinolone antibiotic handles urinary tract infections, gastrointestinal infections, and some respiratory infections that amoxicillin can't touch. Keep at least 2 weeks' worth of 500 milliliter tablets. These references are for general background only. Always check with your doctor before considering any medication. For skin and soft tissue infections, which will become epidemic in a collapse scenario due to poor hygiene and increased injuries, you need cephalexin. This cephalosporin antibiotic is specifically effective against staph and strep bacteria that cause cellulitis, abscesses, and wound infections. Stock a 2-week supply of 500 milliliters capsules. And here's the critical detail that could save a life: doxycycline. This tetracycline antibiotic is your Swiss Army knife for tick-borne diseases like Lyme disease, which will explode when people are forced to live closer to nature. It also treats respiratory infections, certain sexually transmitted infections, and some severe acne that could become infected. Keep at least 3 weeks' worth of 100 milliliters tablets. Understanding which antibiotic to use and when must always be under the supervision of a healthcare provider. Never attempt to diagnose or treat serious infections on your own. Pain management becomes exponentially more important when dental problems, injuries, and chronic conditions can't be professionally treated. Over-the-counter pain relievers aren't just for comfort. They're for maintaining functionality when you need to keep working despite injury or illness. Ibuprofen is your primary anti-inflammatory and pain reliever. Stock at least 1,000 tablets of 200 milliliters strength. This medication reduces inflammation from injuries, manages fever, and controls pain from everything from headaches to broken bones. But ibuprofen damages the stomach lining with extended use and can cause bleeding. That's why you also need acetaminophen, which handles pain and fever without the gastrointestinal risks but offers no anti-inflammatory benefits. Keep 1,000 tablets of 500 milliliters strength. All pain management, especially for chronic issues or severe injuries, must be discussed with your physician. These are informational examples, not personal recommendations. For severe pain that these medications can't touch, you need something stronger, and this is where legal and ethical complications begin. Prescription opioids like tramadol or codeine are controlled substances that you can't legally stockpile without proper prescriptions. But in a true collapse scenario, severe injuries will happen and pain will be unbearable. The ethical solution is building relationships with medical professionals now who understand survival preparation and might help you obtain limited quantities of these medications legally. Document everything, store them properly, and understand that opioid misuse can kill through respiratory depression. An alternative approach is kratom, a legal botanical in most regions that provides mild to moderate pain relief and has been used traditionally for centuries. It's not as powerful as pharmaceutical opioids, but it's accessible and effective for moderate pain management. Never obtain, possess, or use controlled substances without a prescription from your doctor. Gastrointestinal problems will become one of your most frequent medical challenges. Contaminated water, spoiled food, stress, and poor sanitation create a perfect storm for digestive disasters. Loperamide, known commonly as Imodium, stops diarrhea by slowing intestinal movement. Stock at least 200 tablets of 2 mg strength because severe diarrhea kills through dehydration, especially in children and elderly individuals. But here's the critical mistake many make. Stopping diarrhea without addressing the underlying infection can trap bacteria and toxins inside your intestinal tract, making the infection worse. That's why you need to combine loperamide with appropriate antibiotics when bacterial infection is suspected, and why you must understand the difference between viral, bacterial, and parasitic gastrointestinal infections. Only your healthcare professional can properly diagnose and provide guidance on these problems. For nausea and vomiting, which can be deadly when they prevent fluid intake during illness, ondansetron is the gold standard. This anti-nausea medication was designed for chemotherapy patients, but works brilliantly for food poisoning, infections, and motion sickness. Try to obtain at least 50 4 mg tablets. Pair this with promethazine, an older antihistamine that also controls nausea and has sedative properties useful for anxiety and sleep disturbances. Stock 100 tablets of 25 mg strength for parasitic infections, which will become increasingly common when sanitation systems fail and people consume contaminated food and water. You need antiparasitic medications. Mebendazole treats most intestinal worms, including pinworms, roundworms, and hookworms. Stock at least 6 treatment courses. Metronidazole handles giardia and other protozoal infections that cause severe diarrhea. Keep a 2-week supply of 500 milliliters tablets. All anti-parasitic and antiemetic medications must be selected with proper medical guidance, adjusted to your needs and local regulations. Wound care supplies are not optional extras, they're essential components of your medical arsenal. When injuries happen far from hospitals, your ability to clean, close, and protect wounds determines whether someone recovers or dies from infection. Medical-grade gauze pads in various sizes, at least 200 individual pads, form your foundation. Combine these with medical tape that actually sticks to skin even when wet or bloody, multiple rolls in different widths. Butterfly bandages and steri strips close small lacerations without sutures. Stock at least 100 of various sizes. But for deeper wounds that absolutely need closure, you need a suture kit with various needle types and thread materials, along with the knowledge to use them properly. Practice suturing techniques on raw chicken or pig feet before you need to use them on human flesh. Antiseptic solutions prevent the infections that kill more people than the injuries themselves. Betadine solution, which is povidone iodine, kills bacteria, viruses, and fungi. Stock at least 2 liters. Hydrogen peroxide cleans wounds, but don't use it deep inside wounds because it damages healthy tissue and slows healing. Keep 1 liter for surface cleaning. Isopropyl alcohol at 70% concentration disinfects instruments and skin. Stock at least 2 liters. But here's what experience teaches. In a long-term scenario, you'll run out of commercial antiseptics. Learn to make your own using diluted bleach solutions for surface disinfection and understand which plants have natural antimicrobial properties. Honey, particularly medical-grade honey, prevents infection and promotes wound healing. Stock several jars. Antihistamines become critical when allergic reactions occur without access to emergency medical care. Diphenhydramine, commonly known as Benadryl, treats everything from bee stings to allergic reactions to medications. It also functions as a sleep aid and anti-nausea medication. Stock at least 500 tablets of 25 mg strength. But severe allergic reactions that cause anaphylaxis require epinephrine autoinjectors like EpiPens. These are prescription items with limited shelf lives, usually 12 to 18 months, but they remain somewhat effective beyond expiration if properly stored. Obtain at least 4 autoinjectors if anyone in your group has known severe allergies, and train everyone in proper administration technique because anaphylaxis kills in minutes. All allergy treatments, especially for severe reactions, should be managed under medical supervision and planning. Respiratory medications address the breathing problems that can suffocate you when hospitals aren't available. For asthma and severe allergic reactions affecting breathing, albuterol inhalers are essential. Each person with asthma needs at least 4 backup inhalers. For severe respiratory infections and inflammatory conditions, prednisone, a corticosteroid, reduces dangerous inflammation. Stock at least 200 tablets of 20 mg strength. Understand that corticosteroids suppress immune function, so timing their use is critical. For congestion and sinus problems, pseudoephedrine decongestant tablets work more effectively than phenylephrine. Stock at least 500 tablets. Combine with guaifenesin expectorant to help clear mucus from lungs during respiratory infections. All asthma and respiratory medications should be acquired and administered as directed by your treating physician. Cardiovascular medications keep hearts beating and blood pressure controlled when chronic conditions can't be professionally managed. If anyone in your group takes daily blood pressure medications, cardiac medications, or blood thinners, obtaining extended supplies is non-negotiable. Work with physicians now to get 90-day supplies instead of 30-day supplies. Rotate stock to prevent expiration. Understand that suddenly stopping certain cardiac medications, particularly beta blockers, can trigger heart attacks. For emergency cardiac situations, aspirin thins blood and can prevent heart attack damage. Stock at least 500 tablets of 81 mg strength for daily use. And understand that chewing regular 325 mg aspirin during a heart attack can be life-saving. All cardiovascular medical decisions must always involve a healthcare professional. Diabetes management without modern medicine is one of the most challenging survival scenarios. Insulin requires refrigeration and has limited shelf life, but newer long-acting insulins remain somewhat effective even at room temperature for weeks. Diabetics must work with endocrinologists now to develop survival plans, potentially including transitioning to oral medications if appropriate, stockpiling testing supplies, and learning to adjust insulin doses based on diet changes. Metformin, the most common diabetes medication, should be stockpiled in maximum quantities possible. Understanding how diet drastically affects blood sugar and planning a low glycemic survival food supply becomes critical. Never change or stop any diabetic medication regimen without professional medical oversight. Dental emergencies will become frequent nightmares when dentists disappear. Severe toothaches from infections or decay can be debilitating. Oil of cloves, which contains eugenol, provides temporary numbing relief when applied directly to affected teeth. Stock multiple bottles. Temporary dental cement, available at pharmacies, can reattach crowns or fill cavities temporarily. Keep several kits, but actual dental infections require antibiotics, specifically amoxicillin or clindamycin. This is why your antibiotic stockpile must account for dental emergencies, for extractions that become absolutely necessary when infection threatens life. You need dental extraction tools and significant courage because removing teeth without anesthesia is medieval torture. Learn from dental professionals now, while you can. Topical medications address skin problems that range from annoying to life-threatening. Antifungal creams treat athlete's foot, ringworm, and yeast infections that flourish in poor hygiene conditions. Stock multiple tubes of clotrimazole or miconazole. Hydrocortisone cream reduces itching and inflammation from insect bites, rashes, and allergic reactions. Keep at least 10 tubes of 1% strength. For burns, which become more common when cooking over open fires, specialized burn cream with silver sulfadiazine prevents infection. Stock multiple tubes. For severe itching from poison ivy or allergic reactions, calamine lotion provides relief. Keep several bottles. Triple antibiotic ointment prevents infection in minor cuts and scrapes. Stock at least 20 tubes. All topical medications are examples and not personal treatment plans. Review with your healthcare provider. Eye and ear problems can escalate from uncomfortable to dangerous without proper treatment. Antibiotic eye drops treat bacterial conjunctivitis and prevent infection in eye injuries. Stock at least 6 bottles. Artificial tears relieve dry eyes and flush out irritants. Keep a dozen bottles. For ear infections, antibiotic ear drops treat outer ear infections, but middle ear infections require oral antibiotics. Stock at least 4 bottles of ear drops. Eye wash solution flushes chemicals and debris from eyes. Keep at least 2 bottles, though clean water works in emergencies. Vitamins and supplements become essential when diet variety disappears and nutritional deficiencies threaten health. Multivitamins provide baseline nutrition insurance. Stock at least a 2-year supply for everyone. Vitamin C prevents scurvy, which killed more sailors historically than combat. Keep at least 1,000 tablets of 500 milliliters strength. Vitamin D prevents deficiency that causes bone weakness and immune problems, especially during winter months with limited sun exposure. Stock at least a 2-year supply of 2,000 IU capsules. Calcium and magnesium supplements prevent deficiencies that cause muscle cramps, bone problems, and heart issues. Keep a 2-year supply. Never take excessive doses of supplements or vitamins. Consult medical advice first. Women's health supplies cannot be overlooked. Menstrual supplies, including pads, tampons, or reusable menstrual cups, are essential. Stock at least a 2-year supply. Urinary tract infection medications, specifically phenazopyridine for pain relief and antibiotics for treatment, prevent the excruciating pain and dangerous kidney infections that result from untreated UTIs. Yeast infection treatments, including oral fluconazole tablets and topical antifungal creams, should be heavily stocked. For pregnancy scenarios, prenatal vitamins, basic obstetric supplies, and knowledge become critical because childbirth without medical support is dangerous. Mental health medications and stress management supplies address the psychological collapse that accompanies societal breakdown. If anyone takes antidepressants, anti-anxiety medications, or mood stabilizers, stockpile maximum quantities and understand that suddenly stopping certain psychiatric medications causes dangerous withdrawal symptoms. Natural alternatives like valerian root for sleep, St. John's wort for mild depression, and ashwagandha for anxiety provide some relief, though they're less powerful than pharmaceuticals. Stock these in quantity because psychological stability determines survival as much as physical health. All psychiatric medication plans must be discussed in detail with your healthcare provider and never changed or stopped on your own. Storage determines whether your pharmacy saves lives or becomes worthless junk. Medications degrade from heat, light, moisture, and oxygen exposure. Store everything in a cool, dark, dry location, ideally with temperature below 77 degrees Fahrenheit. Use airtight containers with desiccant packets to absorb moisture. Vacuum sealing extends shelf life significantly. Organize by category and clearly label everything with names, strengths, expiration dates, and usage instructions. Create a detailed inventory spreadsheet that tracks quantities, locations, and expiration dates. Rotate stock by using oldest medications first and replacing them with fresh supplies. Understanding expiration dates requires nuance because they don't mean medications instantly become poisonous at midnight on the printed date. Most medications remain effective for years beyond expiration if properly stored, though potency gradually decreases. Critical medications like epinephrine and insulin degrade faster and should be replaced closer to expiration. Antibiotics, pain relievers, and most other medications remain largely effective for years past expiration. The military studies medications stored for decades and finds many remain 90% effective. But never guess with critical medications. Replace them when possible. Obtaining prescription medications legally for stockpiling requires strategy and honesty with medical professionals. Explain your concerns about supply chain disruptions, natural disasters, or extended travel to remote areas. Many physicians understand and will prescribe additional supplies. Consider legitimate online pharmacies that require prescriptions but offer larger quantities. Veterinary antibiotics are chemically identical to human versions and can be purchased without prescriptions, though dosing and quality control require research. Fish antibiotics, specifically fish mox, amoxicillin, and fish flox, ciprofloxacin, are commonly used by preppers, though this involves legal and medical gray areas. Make sure to consult your healthcare provider before considering any of these strategies. Education transforms supplies from worthless pills into life-saving tools. Take wilderness first aid courses, emergency medical technician training, or even paramedic courses if possible. Read medical textbooks focused on austere medicine, wilderness medicine, and disaster medicine. Where There Is No Doctor and Where There Is No Dentist are essential reference books. Practice medical skills on training mannequins, in first aid classes, and during emergencies now while backup exists. Build relationships with medical professionals who can mentor you. Understand that knowledge expires far slower than medications. Documentation and reference materials must be physical, not digital, because electronic devices fail. Print medical guides, drug interaction charts, dosing information, and diagnostic flow charts. Laminate important pages for durability. Create personal medical records for everyone in your group, including medication allergies, chronic conditions, surgical history, and current medications. These become critical when treating unconscious individuals or explaining medical history to other survivors who might have medical knowledge. Your field pharmacy needs redundancy and backup plans because critical supplies will run out, get destroyed, or be stolen. Identify natural alternatives to pharmaceutical medications. Willow bark contains salicin, which metabolizes to salicylic acid, the active ingredient in aspirin. Garlic has natural antibiotic properties. Honey prevents infection. Certain molds produce penicillin-like compounds, though attempting to culture antibiotics is dangerous without proper knowledge. Learn these alternatives now, but understand they're far less effective than modern pharmaceuticals and should be last resorts. Security becomes paramount because desperate people will kill for medications when their children are dying from infections or they're suffering from withdrawal. Never advertise your medical supplies. Store them in hidden locations, separate from obvious survival supplies. Consider creating decoy supplies that can be surrendered during confrontations while real supplies remain hidden. Develop barter strategies because medications will become valuable trading commodities. But understand that trading antibiotics to someone who misuses them could create resistant bacteria that threaten everyone. Building a comprehensive field pharmacy costs thousands of dollars and requires years of accumulation, but compare that cost to the value of life. Start with the most critical categories: antibiotics, pain management, wound care, and medications for chronic conditions affecting your group. Gradually expand into other categories as budget allows. Buy generics instead of brand names to reduce costs. Purchase in bulk when possible. Set monthly purchasing goals and consistently work toward them. And if you want to go deeper, you'll find in the pinned comments some guides and documents that can take your preparedness to the next level. Check them out when you're ready. Building this pharmacy isn't a weekend project. It's a commitment to survival that demands time, money, knowledge, and dedication. But when collapse comes and hospitals become mass graves, when infections kill indiscriminately and pain becomes unbearable, your field pharmacy will be the difference between survival and becoming another forgotten casualty. The supplies you gather now, the knowledge you learn today, and the preparation you complete while society still functions will determine who lives and who dies when everything falls apart. This isn't pessimism, it's realism. And if you understand that reality and want to be ready when others are helpless, then you know what to do. Like this video, share it with someone who needs this knowledge, comment below with your own medical supply recommendations, and subscribe because the information on this channel could save your life. The collapse isn't a question of if, it's a question of when, and your pharmacy needs to be ready before that day arrives.